Board of Elected Trustees for the Tomball Independent School District, and fellow parents. Our original intention was for me to address the board in person. However, one of our sons came home sick today from school. Because of this, we attempted to adjust our plans by having Kenny, who was already in town at 5 p.m., to proceed with signing me up to speak at 5:25, as stated in board policy. Only to be told if I was not there to sign up myself, I could not address the board. This current map of how we as parents have allowed ourselves to be segregated from those we elect to represent our interests must be amended. With all of that said, this video statement may actually prove to be a better tool to communicate our concerns, given that another board policy only allows us 5 minutes total to speak. We want to share up front that we do not take issue with the school board. This statement should not be speculated as a grievance with any of you. There has been no reason presented to us to produce antagonistic feelings against the board. If my day had gone as I planned it, I would have stood before each of you with my vision filled with the image of friends, peers, and concerned parents just like us. But you also have a stewardship granted by oath. With your advocate role for us here in Tomball ISD as a trustee. But that entrusted role is not a separate hat for any of you to need to trade in and out. Since your role is not in direct line of command of a government entity such as the TEA or the Department of Education, your elected role should be synonymous with all of your roles in our community. We assume you view yourselves as one of us still, and it is our hope that you respect our peer relationship. As parents, our roles are often referred to as a gatekeeper, and I believe that this is more than adequate for a job description. Last night, as I listened to the presentation at the board meeting on curriculum mapping, I found myself contemplating the weight of public education with other important subjects of late that have my attention, such as healthcare reform. I asked myself, is the education of my children more important to me than national health care? My answer to myself was yes. Emphatically, yes. I'm here to make a statement about the direct connection I have found between federal and state government to our children's education. Kenny and I have goals in life based upon principles which direct us in our actions as parents. These three principles are, number 1, our loyalty to God. Number 2, our loyalty to our family. And number 3, our loyalty to our country. As parents and American citizens, we believe strongly that these are defining days facing our families, literally at the front doors of our homes at every given turn. There are 3 topics of concern that I wish to bring to your attention. Number 1, the veiled yet real link between public education and the proposed health care reform bill known as H.R. 3200. George Washington said this: "We ought to deprecate the hazard attending ardent and susceptible minds from being too strongly and too early prepossessed in favor of other political systems before they are capable of appreciating their own." Sunday evening, while at a gathering for my husband's family, in between grandchildren visiting with their grandparents and football scores being exchanged with coleslaw recipes, Kenny and I learned of yet another reason to be concerned with the House proposed bill for health care reform known as H.R. 3200. But this particular reason hit a very raw nerve of mine because it focuses on children, potentially my children, and their schools. And of late, the relationship of political events that has had our focus, including President Obama's speech made last Tuesday. We urge each of you to thoroughly research the text from H.R. 3200 that specifically outlines school-based clinics in sections 399Z-1, and it's actually titled School-Based Health Clinics. I'd like to highlight terms that got my attention, but I will tell you that this very lengthy and detailed text has considerable reason to be concerned. And it's quite in-depth. I highlighted for you in the documents that you've been emailed much more that I'm going to actually call out here on video. This first one, factors as determined appropriate by the secretary. Specialty care, mental health, optional services, school-based health clinic. The term school-based health clinic means a health clinic that is located in or adjacent to a school facility of a local educational agency. Sponsoring facility is a community healthcare center, a nonprofit healthcare agency, a local educational agency. And then the final portion of this section of the bill is Title B, and it gives indication of when this is planned to go into effect. Effective date. The Secretary of Health and Human Services shall begin awarding grants under Section 399Z-1 of the Public Health Service Act as added by subsection B not later than July 1st, 2010, without regard to whether or not final regulations have been issued under Section 399Z-1H of such act. In my research on Sunday evening when I got home, I learned that school-based health clinics are in fact up and running in 95 schools between the states of Oregon and West Virginia, and that Planned Parenthood is the stated and advertised chosen nonprofit healthcare agency in many cases. I have included at the bottom 12 websites. Most of them are .gov links. A direct quote from a flyer for Planned Parenthood in Oregon, and I'm going to hold it up for you to see. But I ask you to go and open this link for yourself and look at it. It says, "Join the revolution." And they're in this document that you have, there's embedded a picture copied directly from their website. The picture is of two high school girls. It says, "We're always looking for a few new revolutionaries." Quote, "Each year, Planned Parenthood of Southwestern Oregon recruits a team of enthusiastic, outspoken, and creative high school students for its Youth Action Council." And there is other text at the bottom of this particular website that, in my opinion, is inappropriate for me to offer on camera, because there could be young people who see this. I urge you to open up this link and look at it for yourself and scroll to the bottom at some of the activities they mention to advertise what it is they're going to do. If H.R. 3200 passes, will we look back and find that Section 399Z-1 truly represented Trojan horses in our schoolyards?